They call and they want to talk to me. Can you treat this? Can you treat this? And I always say, I can treat anything. It's because I'm not treating your symptoms. I'm trying to find why is this happening to you. So anything, if you are sick and you have a cold, yes, I have something that I can treat you with. If you have high cholesterol and you are diabetic, of course I can treat that. I have many patients who are on insulin and still have their blood glucose, which is skyrocketing, still high. And even if it's controlled, they feel so bad. They don't feel good. They're stressed, they're fatigued, they have low energy, but their blood glucose is controlled. Then I ask them, something is not right. Then we need to figure out what's not right. Most of my patients that I've worked with, they are off insulin. They are on their blood glucose medication, but we could control their blood sugar without insulin. So it depends on which level you're at, where are you at. And then we'll try to bring you to your optimal level of health. So pretty much we can treat everything. Any gastrointestinal problem, if you had heartburn, peptic ulcer, IBS, food allergies, this is just something that I listed there, but pretty much we treat everything. So chronic constipation, I have some patients that come in and they say, something just doesn't feel right. I don't have a diagnosis. I went to my primary care and they're saying everything is perfect. I don't know what's going on. You're chronically constipated, here, take some fiber. You say something is not just right in my gut. Everything is right. Your ultrasound came back fine. Your all basic labs are fine. You're fine. So I have patients that come in with these random symptoms, no diagnosis. Do I treat that? Of course. I don't need a diagnosis to treat you. I can just go by your symptoms because I'm not treating that. Then I'm going to try to find what's the cause of those symptoms. Cholesterol abnormalities, diabetes management, we're very successful in managing chronic diseases like hypertension, diabetes, cholesterol with natural treatments. Skin problems, eczema, psoriasis, come winter, these things even get worse. People have more skin problems every day. But I'll tell you, most skin problems are related to your gut. If you're not healthy inside, it's going to show outside on your body. And what we're traditionally doing is we're putting steroids on our skin. Good morning. We're putting steroids on our skin and suppressing what's happening. When we are born, most of our kids, I'll tell you, my 3-year-old was born with eczema. And he had really, really bad eczema. I decided not to put steroid on it. Was I up all night? Yes, I was. Natural treatments are not a miracle. It won't give him a quick fix, but I decided to take it in my own hands and I said I will not put steroids on you. And I did. And I treated him for about 6 months to a year. Does he have eczema now? No. Does he have any symptoms? No. Because I treated him, I didn't suppress anything. I didn't suppress his immune system. He doesn't get cold even if he's at daycare. He doesn't get sick when he goes to daycare because I'm supporting his system versus suppressing it. So I give that example not to show how great I'm doing as a mother, but I'm trying to show you that there are options that you can choose for your families that are better than just putting steroids and suppressing what's happening. When your skin shows something, I always tell my patients, when your skin shows something, your body's telling you something's wrong inside of me. And by just suppressing or putting something on your skin, you're telling it, no, just quiet, just keep quiet. I'm not going to fix it because I don't want my skin to look that way. So once I treat, does it get worse? Of course it does. Because if anything is wrong inside, it will come out and then you'll get better. If it stays in, you'll get more problems later in life, right? And then you'll be put on more prescription medicine. But can we take care of that skin problem and make you better? Yes, of course. And is that an easier choice? No, it's not. Especially for parents. It's not an easier choice to look at their kids and say you're suffering. But aren't they suffering on those steroid creams that you have to put every night and every morning, and then it comes back anyway? And then it doesn't work in a week or two, and then you go on a higher dose? Isn't that happening on every medication? Every patient that I see is on an anxiety or a depression medication. Why is everyone on an anxiety medication? I ask my patients, are you feeling better? I don't know. I have no idea if it's helping me. Then I ask them, why are you taking this? Because I don't know if I get off of it, how would I feel? I have no support. My doctor says I have to take it. Do I feel better? I don't think so. But I trust my doctor. So I'm not saying that all doctors are wrong. Some people may need that medicine. But does everyone have to be on an anxiety and depression medication? What do you all think? Not all of us are depressed, right? So I feel like we've accepted this as a culture, as an American culture, that we need to be on these medications to survive. to have our everyday life.